All right, so today we are gonna dive deep, into neuromuscular diseases and specifically how they affect breathing.
Breathing, yeah.
You have provided us with just stacks of research papers and medical texts.
It's a
I've
lot.
got to admit, flipping through it, a lot of big words,
Oh, yeah. Very dense material, but
super
we're going to break it
dense.
down for you. Yes, make it nice and digestible and really highlight, why this is relevant information.
Exactly.
What do you
Yes.
need?
And, just to give a quick overview, right? We've got muscular dystrophies, problems with the nerves and the spinal cord, and then even problems with the connection between the nerves and the muscles.
Which is called the neuromuscular junction, in
Yes.
case you were curious.
Yes.
So, and what's interesting is that a lot of these diseases, they impact your respiratory system in a somewhat predictable pattern.
Predictable, so that's good, right? That means that doctors can spot it early on.
It can be helpful, yes. It often starts very subtly
Okay.
with things like fatigue and poor sleep,
Okay.
things that we all experience.
Yeah.
But in this context, could be a sign of something more serious.
Right. Okay. So like a canary in a coal mine kind of thing, like an early warning sign.
Yeah,
Interesting.
yeah,
Okay. One of the sources mentioned that people with these conditions are especially vulnerable at night.
yes.
Something to do with muscle weakness and laying down.
Well, think about it. When you sleep, your muscles naturally relax, right?
Okay.
But for somebody with a neuromuscular disease, that relaxation can actually worsen their weakness
Okay.
because those muscles aren't being used to breathe as effectively.
So it's like they're already working harder, and then at night it's like trying to run a marathon in your sleep.
Kind of, yeah. And that constant strain can lead to something called atelectasis, which
Atelectasis.
is where portions of your lungs actually collapse,
Oh, wow.
like deflated balloons because they're not getting enough air.
Oh, gosh.
And on top of that, coughing, which is our body's way of clearing things out,
Yeah.
becomes a struggle.
Right.
All of this can eventually lead to respiratory failure,
Wow.
which is why recognizing those early warning signs is so important.
Yeah, for sure. So, we need to understand how this weakness actually affects the lungs themselves. The source material used the term restrictive ventilatory defect.
Right.
What does that even mean?
Well, it basically means that the lungs aren't expanding as well as they should.
Okay.
Imagine trying to inflate the stiff balloon.
Okay.
It takes more effort, and you might not be able to fill it up completely.
Right.
That's similar to what's happening in these diseases.
So the lungs are like stiff balloons.
Exactly.
And doctors actually have a way to measure this stiffness?
They do. They use something called pulmonary function tests, or PFTs,
PFTs.
to see how well your lungs are working and if they're showing this restrictive pattern.
Wow.
It's a really important tool for diagnosing and managing these conditions.
Okay, so we've got this overall picture of what's happening in the lungs. Now, let's look at some specific diseases. I think everyone's heard of muscular dystrophy.
Of course.
The sources really focused on Duchenne muscular dystrophy, which affects mostly young boys.
Yeah, this one is particularly devastating. It's a genetic disease that causes progressive muscle wasting,
Okay.
and eventually it impacts the muscles needed for breathing.
Wow.
It's heartbreaking, especially considering it often leads to an early death, sometimes even before the age of 20.
That's so young.
Very young.
The sources also mentioned Becker muscular dystrophy, which is
Yes,
Melder, right?
Becker muscular dystrophy tends to appear later in life, but both forms really highlight how these diseases can have such a profound impact on the respiratory system.
Yeah, it makes you wonder, what kind of research is being done to treat these conditions.
We'll definitely touch upon that later.
Okay.
But for now, let's move on to another condition that affects the nerve-muscle connection,
Okay.
myasthenia gravis, or MG.
Oh, yeah, this one was described as muscles getting tired with every use like a battery that drains too quickly.
Yes,
I thought that was such a vivid way to put it.
it is a great analogy.
Yeah.
And it gets to the heart of what's happening. In MG, your immune system actually produces antibodies that block the signals from your nerves to your muscles.
So it's like the messages telling your muscles to contract are getting lost in translation.
Exactly. And without those clear messages, your muscles weaken, especially with repeated use.
Okay.
It's like trying to send a text message with a bad signal. It might go through once, but eventually the connection just drops.
Right. Okay. It's amazing how doctors even figured this out.
Right.
The sources mention a diagnostic test using ice packs on drooping eyelids.
Oh, yeah?
How does that even work?
Well, it's pretty ingenious.
Yeah.
In MG, the muscles controlling the eyelids are often affected, leading to drooping.
Right.
The cold from the ice pack could temporarily improve muscle strength. So if the drooping improves after applying the ice, it could be a strong indicator of MG.
Oh, wow.
Of course, there are other tests too, but the ice pack test is simple and often used as a first step.
That's fascinating. Okay, so now let's move on to Guillain-Barré syndrome, or GBS. One of the scariest things I read in these sources was how this one can come on so suddenly.
Yes, GBS is known for its rapid onset.
Okay.
It's an autoimmune disorder, meaning your body's immune system mistakenly attacks its own nerves.
Oh, wow.
It's often triggered by an infection, and it can lead to paralysis that progresses quickly, sometimes within days or weeks.
So you could be perfectly fine one day and then struggling to breathe the next.
It can happen.
That must be terrifying for
It
patients.
can be incredibly frightening, and if the paralysis affects the breathing muscles, it can be life-threatening. That's why early diagnosis and treatment are crucial in GBS.
Is there any hope for recovery with this one?
Absolutely. The good news is that most people with GBS do recover,
Okay.
though it can take time, sometimes months, sometimes even years.
Okay.
But the human body is incredibly resilient, and with the right medical care and rehabilitation, people can make remarkable recoveries.
That's reassuring. Now, this next one, ALS, is one that I think most people have heard of. It's more commonly known as Lou Gehrig's disease.
Right, amyotrophic lateral sclerosis, or ALS.
Yes.
This one is truly devastating. It involves progressive degeneration of motor neurons, which are the nerve cells that control your muscles.
Okay.
This leads to paralysis, eventually affecting the muscles needed for breathing, speaking, and swallowing.
And it's a disease that gets a lot of attention, especially with high-profile figures like Stephen Hawking and Steve Gleason battling it publicly.
Absolutely. And their courage in the face of this disease has been truly inspiring.
For sure.
While there is currently no cure for ALS, supportive treatments and ventilatory assistance can make a huge difference in improving quality of life and extending survival.
So even if it's incurable, there are ways to manage the symptoms and help people live as comfortably as possible.
Exactly. It's about focusing on what we can do to help patients and their families cope with this challenging disease.
You know, going through all these sources, one thing that really stood out to me was the role of respiratory therapists. They
Yes.
seem to be so critical in caring for people with these conditions.
They're the unsung heroes on the front lines.
One quote that really stuck with me was, "They're the detectives of the lungs, figuring out why someone can't breathe and then putting together a plan to help them."
That's a great way to put it.
Yeah.
They're constantly monitoring lung function, providing treatments like oxygen therapy, and managing ventilators for patients who need assistance breathing.
It's clear that their expertise is absolutely crucial in managing these complex cases.
Absolutely. And it's not just about the technical skills. Respiratory therapists also provide emotional support and education to patients and their families, empowering them to take an active role in their care.
Okay, so we've covered a lot of ground here in part one of our deep dive. We've learned about the general ways these diseases impact breathing, and we've even gotten into specifics about some of the most common conditions.
But we're just getting started. In the next part, we'll explore some even more fascinating conditions that affect the neuromuscular system, and we'll delve into the latest research and advancements in treatment.
You won't want to miss it. We'll be back in a flash. Welcome back. I'm ready to keep exploring these neuromuscular diseases.
Yeah, we've covered a lot, but there's
so much more.
so much more.
Yes, as the source material is packed.
It's like peeling back the layers of an onion, each layer revealing something new.
Ooh, okay, so what layer are we peeling back next?
Well, we touched on muscular dystrophies, but there's one in particular that I think you'll find fascinating: myotonic dystrophy.
Is that the one where the muscles have a hard time relaxing, like they get stuck?
You got it.
I think the sources used a term. I had to look up myotonia.
Myotonia.
What is that?
Myotonia. That's it.
Okay.
It's actually the most common type of muscular dystrophy in adults. And guess what? Breathing problems are a frequent complication.
Figures, but why is that? Is it the same like stiff balloon effect we talked about earlier?
It's a bit different. Remember, we're talking about muscles that can't relax easily?
Right.
So this can affect the muscles in your chest wall, making it harder for your lungs to expand fully.
Oh, okay.
And what's interesting is that people with myotonic dystrophy are often very sensitive to anesthesia and medications that can depress breathing.
Oh, that's a pretty big deal for doctors to know,
Huge, especially if someone needs surgery.
especially if they need surgery.
Exactly.
Wow, it really highlights how crucial it is for medical teams to have a deep understanding of these different conditions.
I completely agree. And speaking of different conditions, the sources also delved into a couple of inflammatory muscle diseases called polymyositis and dermatomyositis.
Okay.
They can affect breathing too.
Inflammatory, so it's like the muscles are constantly irritated and swollen.
Yeah, think of it like that.
How does that impact the lungs, though?
Well, these conditions often go hand in hand with something called interstitial lung disease,
Okay.
which affects the tissue surrounding the air sacs in your lungs.
So it's not just the muscles themselves, it's the
Oh.
tissue around the lungs that can cause problems, too.
Right? It's like the scaffolding that supports your lungs is becoming inflamed and scarred, making it harder to breathe.
It's almost like a domino effect, with one problem leading to another.
That's a great way to think about it. And that domino effect brings us to a really important issue, especially in critical care settings: ventilator-induced diaphragm dysfunction.
Or what is it?
That
Vivid.
sounds intense. What is that exactly? Well, it's a bit ironic, actually. Sometimes when people are on a ventilator for a long time,
Right.
the machine can end up doing too much of the work for the diaphragm,
Oh, okay.
the main muscle we use for breathing.
So it's like the diaphragm's getting lazy because the machine is doing all the heavy lifting.
Exactly. And just like any muscle that isn't used, it could weaken and atrophy, leading to VIDID.
Oh, wow.
It's this delicate balance. Doctors need to provide enough support with the ventilator, but also encourage the diaphragm to stay active.
It makes sense. It's not just about hooking someone up to a machine and calling it a day.
Right.
There's a lot of skill and monitoring involved.
Absolutely. Now, so far, we've mostly focused on diseases that directly affect the muscles,
Right.
but remember, there are also conditions that impact the nerves that control those muscles.
Right, like a breakdown in communication.
Exactly.
One that caught my eye was Lambert-Eaton syndrome. I think it's often linked to cancer, right?
You're right. Lambert-Eaton myasthenic syndrome, to give it its full name, is often associated with cancer, particularly lung cancer.
Okay.
It's another autoimmune condition where the immune system attacks the connection between nerves and muscles.
So instead of messages getting lost, like in MG,
Yes,
it's like the signal itself is weak.
that's a good way to think about it.
Okay.
And here's a key difference between Lambert-Eaton and myasthenia gravis.
Okay.
In MG, muscle weakness gets worse with repetition, but in Lambert-Eaton, it actually improves with repeated use.
Oh, that's a really important distinction.
Very important.
Yeah, doctors would need to know that to make the right diagnosis.
For sure. And speaking of nerves, there's something called phrenic nerve dysfunction, which can also cause serious breathing problems.
Wait, refresh my memory, phrenic nerve. That's the one that controls the diaphragm, right?
That's the one. It originates in your neck and travels down to your diaphragm. Think about it. If that nerve gets damaged, it could partially or completely paralyze your diaphragm.
Yikes. What could cause damage to that nerve?
A lot of things. It could be anything from a viral infection like pneumonia to trauma to the neck.
Okay.
Even certain types of surgery can inadvertently damage the phrenic nerve.
So this is all getting at the fact that breathing problems can also stem from issues with the spinal cord itself.
Absolutely.
We already talked about ALS, but what else is there?
Oh, there's a whole range of spinal cord disorders that can impact breathing.
Okay.
Spinal cord injuries, of course,
Okay.
where the level of the injury is crucial.
Okay.
If the injury is high up in the cervical spine, it can affect the nerves that control the diaphragm, leading to immediate respiratory compromise.
So the higher the injury, the more serious the breathing problems.
Generally, yes. Then there are conditions like transverse myelitis, which is inflammation of the spinal cord,
Okay.
and even things like polio and spinal cord tumors.
Oh, wow.
All of these can disrupt the signals traveling between the brain and the muscles involved in breathing.
The sources even mentioned ankylosing spondylitis. Isn't that a type of arthritis that affects the spine?
You're sharp, and it can definitely impact breathing. Ankylosing spondylitis is characterized by inflammation that can eventually lead to fusion of the vertebrae, making the spine stiff and inflexible.
Right.
This can restrict chest movement, making it harder to breathe deeply.
Wow. So it's not just about the nerves and muscles themselves.
Nope.
It's the whole skeletal system that can play a role in these breathing problems.
It's all connected, and that's why taking a holistic approach to managing these conditions is so important.
And speaking of holistic approaches, we have to talk more about the amazing work that respiratory therapists do.
Yes.
I mean, they're on the front lines dealing with all these complex conditions.
They truly are the unsung heroes of respiratory care. They're constantly monitoring patients, adjusting ventilator settings, providing breathing treatments, and helping patients manage their secretions.
It's true. They really are like detectives figuring out what's causing the breathing problem and then putting together a customized plan to help each patient.
Exactly. And let's not forget the emotional support they provide. They're often there for patients during some of the most difficult moments, offering reassurance, education, and a listening ear.
They're a crucial part of the care team, that's for sure.
Absolutely. And in the next part, we'll shift gears a bit and explore the latest research and advancements in treating these conditions. There's a lot to be hopeful about, so stay tuned.
It's amazing how many different conditions can affect the muscles and nerves that control breathing. You know, it really makes you appreciate how intricate and interconnected our bodies are.
Absolutely. Every breath that we take is a testament to that complex interplay
Yeah.
of systems in our bodies. And when one part of that system is disrupted, it can have a ripple effect throughout.
Yeah, one thing that really struck me while going through all these sources was the emphasis on early detection and intervention.
Yes,
It seems like the sooner you catch these conditions, the better the chances of managing them effectively.
absolutely. Early diagnosis is key. It allows us to start treatments sooner, potentially slowing down the progression of the disease and preserving lung function. It also gives us more time to implement strategies to maintain quality of life.
The sources also talked about the importance of a multidisciplinary approach to care.
Yes,
It's not just about seeing one specialist, it's about having a whole team of experts working together.
exactly. Think about it. You might have neurologists who specialize in the nervous system, pulmonologists who focus on the lungs, respiratory therapists who are experts in breathing treatments, and managing ventilators, physical therapists to help maintain strength and mobility, and even occupational therapists to assist with daily living activities.
It's like a whole army of healthcare professionals,
Right.
each with their own unique expertise coming together to create a personalized battle plan for each patient.
That's a great analogy. It really is a team effort, and each member plays a crucial role. And let's not forget the most important member of the team, the patient themselves.
Right. It's their body, their life, their experience.
Exactly. Patients and their families need to be active participants in their care. They need to feel empowered to ask questions, make informed decisions, and advocate for their needs.
It's about that partnership between the medical team and the patient working together towards a common goal.
Couldn't have said it better myself. Now, shifting gears a bit, you mentioned earlier that you were curious about research and advancements in treatment.
Oh, yeah.
The good news is there's a lot happening on that front.
Oh, good, because reading about some of these conditions, it's easy to feel a little overwhelmed, even a bit hopeless.
I understand. But there are reasons to be optimistic. For example, in the field of muscular dystrophy, gene therapy is showing a lot of promise.
Gene therapy.
Yeah,
So they're trying to actually correct the faulty genes that cause these diseases.
that's the idea. It's still early days, but the initial results are encouraging. For Duchenne muscular dystrophy, there are clinical trials underway using different gene therapy approaches, and there's hope that these therapies could slow down or even halt the progression of muscle degeneration.
That would be incredible. What about other conditions like ALS or myasthenia gravis? Any breakthroughs there?
For ALS, researchers are exploring a variety of potential therapies, including stem cell therapy, immunotherapy, and new drugs that target specific pathways involved in the disease process.
And what about that nerve-muscle connection problem, myasthenia gravis?
There are exciting developments in MG as well. New medications are being developed that work in different ways to improve nerve-muscle communication. And there's a growing understanding of the role of the thymus gland in MG, leading to more effective treatment strategies.
It's so encouraging to hear about all this progress. It gives you a sense of hope that maybe someday these conditions won't be so devastating.
I agree. And it's not just about finding cures. There's also a lot of research focused on improving quality of life for people living with these conditions. This includes developing better assistive devices, refining respiratory care techniques, and finding ways to manage symptoms more effectively.
So it's a multifaceted approach, tackling the disease itself while also making life easier and more fulfilling for those affected.
Exactly. And let's not forget the power of support groups and online communities.
Yeah.
These can provide invaluable emotional support, practical advice, and a sense of connection for people living with these conditions and their families.
So to wrap things up, what would you say is the most important takeaway for our listener today?
I would say knowledge is power. By understanding these conditions, how they affect the body, and the latest advancements in treatment, you can be a better advocate for yourself, your loved ones, or anyone facing these challenges. Don't be afraid to ask questions, seek out reputable sources of information, and connect with others who are going through similar experiences.
Beautifully said. And remember, even though these conditions can be incredibly challenging, there's always reason for hope. Research is constantly evolving, treatments are improving, and the human spirit is incredibly resilient. Thanks for joining us on this deep dive into the world of neuromuscular diseases and respiratory compromise. We hope you found it informative, insightful, and maybe even a little bit inspiring. Until next time, keep exploring, keep learning, and keep breathing deep.